Welcome to The Explainer. Today, we're breaking down the truly complex world of treatments for inflammatory bowel disease. You know it as IBD. We're going to get into everything from these smart drugs that only kick in right where they're needed, all the way to biological guided missiles that target the very source of the inflammation.
So, before we jump into the solutions, you've really got to see the problem. On the left, you've got a healthy colon. It's smooth, it's calm, but on the right, that's the reality of an IBD flare-up. It's a raw, inflamed battleground. This is exactly what these treatments are up against, a literal fire inside the body that they are designed to tame.
So what is IBD, really? And what's causing all this damage? Well, it all boils down to the immune system just getting its signals totally crossed. Okay, try to think of your immune system as your body's own personal security force. Now, in IBD, this security team gets some really bad intel. It starts to misidentify the normal, totally helpful bacteria in your gut as dangerous intruders. And for folks with a certain genetic makeup, this false alarm triggers an all-out friendly fire attack on the gut itself.
Now, IBD isn't just one thing. It comes in two main forms. On the left, you've got ulcerative colitis. This is kind of like a fire that only burns in one place, the colon, and it just affects the surface layer in one long, continuous stretch. Crohn's disease, though, over on the right, that's more like scattered embers. It can pop up literally anywhere along the digestive tract and can burn deep, right through the bowel wall, often in these disconnected patches.
All right, so now that we know what we're up against, what are doctors actually trying to accomplish with treatment? Let me tell you, it's about way more than just quieting down the symptoms.
The ultimate goal here isn't just to put out the fire, it's to rebuild the whole house. Doctors want to get patients into remission, which means no active inflammation, and crucially, keep them there. And that means a better quality of life, freedom from having to rely on harsh steroids, and lowering those really serious long-term risks, like cancer, that come with chronic inflammation.
So to navigate all this, doctors often use what's called a step-up approach, which you can see here visualized as a pyramid. The whole idea is pretty simple. You start with the safest, mildest treatments down at the base, and you only climb up to the more powerful, more complex therapies at the top if you absolutely have to. So let's start at the bottom and work our way up.
Okay, let's get into it. We're going to start at the base of that pyramid with the first kind of medication that most people with mild to moderate disease will come across.
So the foundation of this whole pyramid is a class of drugs called aminosalicylates, or just 5-ASAs for short. The easiest way to think about them is like a soothing cream that you'd put on a rash, but this is one that's designed to work on the inside lining of your gut. For mild to moderate disease, this direct, localized approach is often the very first and safest step.
But there's a really clever chemical puzzle that needs to be solved here. See, 5-ASA gets absorbed really easily in the small intestine. But a lot of the time, the inflammation is way further down in the colon. So the question is, how do you get the medicine to the right place without it getting soaked up way too early?
And the solution? Honestly, it's just brilliant. Scientists created a kind of special delivery package. They took the active drug and attached it to a carrier molecule using this special chemical link called an azo bond. Think of this bond as a timed-release lock. It's too strong to be broken by anything in the stomach or the small intestine. The only thing in the whole body that has the key is a specific type of bacteria that lives in the colon. So the drug travels all the way down completely untouched, gets to its destination, and only then is it unlocked and released to do its job. It's an incredible piece of bioengineering.
This slide is a perfect illustration of how that same basic idea is applied in a bunch of different ways. You can see pills with these special coatings that are designed to dissolve at just the right pH level, making sure they open up in the small intestine. And for inflammation that's even lower down, you have direct delivery methods like enemas or suppositories. It is all about getting the right medicine to the exact right spot.
Okay, so let's move up to the next level of the pyramid. This is for patients whose disease just doesn't respond to that first line of defense, or for anyone who's going through a more severe flare-up.
Look, when the fire is absolutely raging out of control, you need a fire hose, not a sprinkler. And that's exactly the role of corticosteroids. These things are powerful, system-wide anti-inflammatories that can just douse a severe flare-up and do it fast. They're incredibly effective for getting things under control, but just like a fire hose, they can cause a lot of collateral damage, which is why they are not a long-term solution.
So once the fire's out, how do you stop it from starting up all over again? Well, that's where the next level of treatment comes in, immunosuppressants. But, and this is a big but, as this quote points out, these are not for emergencies. Their effects are delayed.
So the key thing to get here is that these drugs are not firefighters. They're more like fire prevention. They work slowly, over weeks or even months, to basically turn down the thermostat on the entire immune system. This makes them perfect for long-term maintenance, especially for people who find that the inflammation comes roaring back every single time they try to stop taking steroids.
All right, it's time to climb to the very top of the pyramid. This is where we find the most advanced and specific treatments out there for severe IBD that hasn't responded to anything else.
At the very peak of the pyramid are the biologics, and these have truly revolutionized IBD treatment. Instead of suppressing the entire immune system, these are like molecular guided missiles. They are literally engineered to hunt down and neutralize one very specific target. A really common target is a protein called TNF-alpha, which acts like a master alarm signal that's screaming at the immune system to attack. By taking out just that one signal, you can quiet the inflammation without shutting down the entire system. Now, there's another really targeted approach that works a bit differently. Instead of taking out the alarm signal, this one just sets up a roadblock. It actually prevents the immune system's soldiers, those inflammatory cells, from ever reaching the battlefield in the first place. These drugs block the doorways that the cells use to leave the bloodstream and get into the gut tissue. And hey, if they can't get in, they can't cause damage.
So as this summary really shows, the step-up pyramid is actually a very sophisticated toolkit. Doctors can start with localized treatments at the base, move up to broader immune suppression if they need to, and for the most severe cases, they can deploy these highly specific, targeted therapies at the top. It's all about finding the right tool for each individual patient.
So we've climbed the pyramid from general inflammation control all the way up to therapies that can reprogram the immune system on a molecular level. But the journey doesn't stop here. The future of IBD treatment is all about making this pyramid even more personalized, using genetic and microbial data to predict which treatment will work for which patient right from the very beginning. The goal is no longer just to control the fire, but to prevent it from ever starting in the first place.